thanks for joining us today. We're heading quickly into respiratory season, which includes flu, COVID-19, and RSV. This is a season that's going to be unpredictable and complicated, especially given the lingering pandemic as well as the low flu season from last year. Today, we're going to chat through how COVID-19 is shifting the approach to testing as well as key considerations on vaccines. This discussion should help patients and health systems prepare for the upcoming season. I'll start by introducing myself. I'm Chris Huber, Director for Point of Care and Infectious Disease for the Cardinal Health Lab business. And I am thrilled to be joined today by two leaders who each bring a unique perspective on the upcoming respiratory season. Emily Berlin, Vice President of Marketing and Product Management for the lab business, leads a team that's dedicated to lab-based products and solutions. Specific to respiratory testing and vaccines, her team provides a comprehensive portfolio of testing solutions as well as purpose-built vaccine storage and transport options. Hi, Emily.
Hey, Chris. Thanks for having me here today.
And Greg Jones. Greg is a registered pharmacist focused on developing pharmacy-based clinical solutions for community settings. Greg leads the efforts at Cardinal Health to expand pharmacist point-of-care testing for COVID, flu, strep, and other disease states. Greg also leads vaccine strategy and improved pharmacy workflow focused on enhancing the customer experience. Hi, Greg.
Great to be here, Chris and Emily.
And before we dive in, it's important to note that while we will be discussing our general observations on flu, RSV, and COVID-19 today, we're not here to give medical advice. Always consult your doctor or other qualified healthcare professional with any questions you may have regarding your health or medical condition. With that, let's get started. Emily, there's a lot of uncertainty about the upcoming respiratory season. As we enter our second respiratory season while in a pandemic, what's changed from last year to this year when it comes to testing?
That's right, Chris. It's hard to believe, but we are entering our second respiratory season while still in a pandemic. And what's changed is that COVID-19 has elevated both the awareness as well as the role that diagnostic testing plays in our healthcare system. More than ever before, testing has become a household conversation. When you think about it, a patient's understanding not only of the types of tests available, but as well as their desire to be tested has significantly increased. Patients are truly seeking to have definitive answers on their healthcare status. The other rapidly changing dynamic is both how and where a patient is accessing testing. More and more, patients are seeking more convenient, closer to home options, such as local pharmacies.
Thanks, Emily. Greg, can you share your perspective on what we're expecting from this year's respiratory season? Specifically, how are pharmacies preparing?
This is shaping up to be a very active respiratory season in the community pharmacy setting. Over the last 18 months, pharmacists have really stepped up to meet the healthcare needs of the communities they serve. They've implemented new appointment-based models so patients can be treated more efficiently. They've become very active in COVID vaccinations in their communities and towns they service. They're also now able to offer rapid testing for COVID, flu, and strep at the pharmacy location, and flu vaccinations are now in full swing. A patient can get a flu vaccination and COVID vaccination at the same time in one visit. After a very low flu season last year, due to patients being socially distant, using proper hand sanitation, wearing masks, and avoiding large crowds due to COVID, we're projecting a rise in positive flu cases this year. Flu is often transmitted the same way, and the steps to prevent the spread of COVID last season lowered flu outbreaks as well. With folks going back to work, attending school in person, and an increase of large gatherings, it would be expected to see an increase in viral infections this season.
Thanks, Greg. Emily, I'm interested in your perspective on regardless of care setting, and Greg gave us a lot of different care settings there. How can testing lead to a more timely treatment of viruses and to mitigate spread?
Well, Chris, simply stated, it all starts with the test. And this is true not just of respiratory testing, but of diagnostics in general. Diagnostic testing provides the crucial information that sets in motion a cascade of care, treatment, and public health measures. Respiratory tests, including those for flu, RSV and COVID are readily available at healthcare providers and pharmacies and are the primary tool for getting patients on the applicable antiviral therapies within the appropriate time frame. The knowledge of a positive test also enables the patient to take the appropriate public health measures, such as quarantining, to prevent further transmission. Specific to COVID, testing plays a key role not only in diagnosis, but also in long-term surveillance. Effective testing strategies can help mitigate outbreaks and the emergence of hotspots.
Thanks, Emily. Question for both of you. What programs has Cardinal Health developed to help customers with testing needs during this season? We'll start first with Greg with specific solutions for community and retail pharmacies.
This year, we've enhanced pharmacy workflow programs using an appointment-based scheduling tool called My Scheduler, which allows pharmacists to identify when they're available to offer these critical services in their community. They also function to provide a reminder to patients when the vaccine requires a second dose and when the patient should be returning the pharmacy to get that second dose. And also, we've launched new delivery options. Cardinal has been coordinating a very large network of community pharmacists to distribute and administer a COVID vaccine this season. We've been communicating credible and up-to-date information from the CDC to share with community pharmacists and patients. We have expanded options for pharmacist-led testing in our community settings. We also have a full complement of available flu vaccine products this year. Finally, we've increased awareness of personal protective equipment and sanitation procedures to keep our pharmacists, pharmacy technicians, and customers safe.
Thanks, Greg. And Emily, what solutions has the lab business developed to meet emerging customer needs this season?
Chris, from a testing perspective, we're supporting traditional healthcare entities as well as supporting the evolving needs of organizations such as schools, workplaces, and local communities. Our team at Cardinal Health is working with them to deploy effective testing strategies specific to their unique populations. And now, with the traditional respiratory season just around the corner, we have launched a new program aimed at enabling healthcare providers to be better prepared for the uncertainties of the respiratory season. This program is called a Reserve Inventory Program. And as a part of this program, it leverages advanced analytical insights that provides our customers with a roadmap of their respiratory test utilization. And it also enables them to pre-book known quantities of product for their anticipated season. Products included in this program are select COVID, RSV, and flu products, as well as Strep A, even though Strep A isn't a respiratory virus. We believe that the benefits of this program provide providers with the peace of mind that they're able to have known quantities of key respiratory products already reserved for them within the Cardinal Health Network. What this translates to from a patient perspective is that patients will have consistent and convenient access to testing in their local communities.
Thanks, Emily. At this point in the pandemic, most of us have experienced some sort of symptom onset. Maybe we have congestion, a headache, fever, so we quickly schedule a COVID test at our nearest testing site. In your opinion, has COVID-19 shifted people's mindsets at all about getting tested at the appearance of symptoms for something like COVID or the flu?
Yes, Chris, I do think that there is both a greater awareness and a greater willingness to be tested. And in my opinion, this is one of the positive outcomes associated with the COVID pandemic. The desire and the willingness to be tested is also likely to translate to other respiratory viruses as they start to circulate in greater prevalence this season. When a patient may have historically opted to just fight through their symptoms, not go to their provider, or be tested, this year there is a much greater desire to know, do I have flu, do I have COVID, or do I just have an upper respiratory infection? And this season, there's much talk around the potential co-circulation of both flu and COVID. When you think about the fact that these two viruses share some of the same symptoms, patients and providers are definitely going to want to know, is it flu or is it COVID? And this potential co-circulation will also require providers to be proactive and nimble in how they prepare for what is expected to be a very tumultuous respiratory season.
That's such a great point, Emily. And Greg, we know the treatment window for the flu is short. Talk to us about the role that pharmacies can play given that short treatment window.
RSV often starts with cold-like symptoms and frequently under the age of 2 with perhaps a cough. Flu starts quickly with high fever, aches and pains, and antiviral treatment should be started within 48 hours of testing positive. You need to be tested quickly to confirm the positive infection and then to stop the necessary antiviral treatments. COVID is a little more gradual, and it may be noticed with changes in taste and smell. Treatment must be started within the first 10 days of symptoms. With sooner treatment, the better, and requires a positive COVID test to at least limit contacts with individuals if you do test positive.
Thanks, Greg. Shifting gears a bit to vaccines, in your opinion, how will COVID-19 vaccination rates impact vaccination rates for the flu? What are pharmacies seeing this year that's different than last year in terms of vaccination rates for the flu?
Over the last 18 months, we've seen a tremendous increase in the number of patients coming into the community pharmacy to get vaccinated for COVID. We're expecting to see a similar rise this year in patients returning to the pharmacy to get their COVID booster shot and also the annual flu vaccine.
Thanks, Greg. Emily, we have certainly seen a lot of innovation over the last 18 months when it comes to testing. For example, over-the-counter COVID-19 COVID tests. Where do you think the future of testing is headed? And how could that change the way that we approach not only this respiratory season, but respiratory seasons for years to come?
One of the great things about diagnostic testing is that it's constantly evolving. There are constantly new technologies, new testing platforms, increasing test sensitivities, and all of these advances translate into more precise information that better informs patient care. But specific to the pandemic has yielded multiple diagnostic tests, all which have been developed in record time. And having worked very closely with many of these diagnostic manufacturers, I can say that they all worked tirelessly to bring these products to market as quickly as possible. And this truly speaks to the passion and dedication that their organizations have for the role that testing plays, not only in combating the pandemic, but also in patient care in general. But one of the most notable advances in COVID testing has been in the over-the-counter or OTC designation for COVID tests. Having COVID tests available over the counter to consumers enables them to be in the driver's seat for their care. Over-the-counter tests provide quick, reliable answers and further increases access to testing. At Cardinal Health, we have worked closely with both Abbott and Quidel on increasing the reach for their over-the-counter COVID tests, which helps ensure broad access to testing in our local communities. And what I would finish with is that with the consumerization of healthcare continuing to be a key healthcare trend, it's easy to envision scenarios where testing becomes more decentralized. This could result in testing being performed in alternate settings or even in the home with the proper clearances.
Thanks, Emily. And lastly, if you both could leave people with one key takeaway today about the upcoming season, what would you want them to know?
If you have any questions related to COVID, flu, or RSV, please consult with your healthcare provider, and they can help clarify any questions you may have.
Thanks, Greg. Emily?
Well, Chris, what I would like to leave the audience with is this. Effective testing strategies and broad access are critical in any respiratory season. And this importance really is twofold. It's important for the health of the patient as well as for the health of the community. Testing plays a key role in the patient receiving the proper treatment in a timely fashion. But testing is also important for the health of our communities. By effectively diagnosing the prevalence of infection, actions can be taken to reduce transmission in communities and populations.
Thanks, Emily. And thanks to both of you for joining us for this discussion today. We've had some great insights on the impact of COVID-19, potential impacts on the upcoming respiratory season, and solutions Cardinal Health has developed to support our customers. You can learn more about Cardinal Health's effort to combat respiratory season by visiting cardinalhealth.com respiratory resources. Thanks again for joining us.